Welcome to the course on TMS provider for Medical Superintendent, MEDCO, and PMAM. This course contains 8 topics. We are now in topic 3, registering a patient. You need to be a medical superintendent, medical coordinator or MEDCO, or a Pradhan Mantri Arogya Mitra, also known as PMAM, to register a patient on the Transaction Management System or TMS provider application. To do this, you should have signed up and acquired any of the above roles on the User Management Portal, or UMP. By the end of this topic, you will be able to register a patient on the TMS provider application. Upon logging in, your dashboard and work list are displayed. For this training, we have logged in as a medical superintendent. First, click the New Patient button. On clicking the button, the Search Beneficiary page opens. Here, you need to select the implementing agency from the drop-down. Next, enter the patient's Ayushman ID, a mobile number, or Aadhaar number. Ayushman ID is the PMJ ID or the health ID of the patient. And Aadhaar number is the universal health account provided to the citizens as part of Ayushman Bharat Digital Mission, also known as ABDM. The search button gets enabled on entering the patient's PMJ ID, mobile number, or Aadhaar number. Next, click the search button. And the application displays a card with the patient's details. The details include name of the patient, their PMJ ID, age, gender, mobile number and address, including the district and state to which the patient belong. The details also include the care plan and their Aadhaar number. Next, click the Verify button to verify the patient's identity. The Verify Beneficiaries section appears. Here, you can authenticate the beneficiary via fingerprint, iris scan, or Aadhaar OTP. You need an external device to authenticate the patient via their fingerprint or iris. As a medical superintendent, you have the option to proceed with the patient's registration without Aadhaar authentication. For this training, let us proceed without Aadhaar authentication. Now, click the Proceed button to continue. On clicking the button, the application displays the Register Patient page. It includes the patient's details such as their name, age, gender, mobile number, PMJ ID, and address. For a newborn baby, you will have to select the Newborn Baby checkbox. This page has 4 sections: communication address, care plan, patient attendant details, and authentication consent. Authentication consent section is available only for a medical superintendent when they register patients without Aadhaar authentication. Let us start with the communication address section. Select the current communication address is same as card address checkbox if the patient's address is the same as the one displayed on the card. And if the patient has a different communication address, enter the address details. When you select the checkbox, the application takes the patient's communication address from the Beneficiary Identification System or BIS. Now, enter the name of your village, town, or city. Next is the Care Plan section. This section displays the default care plan of the patient. And if the patient has enrolled in 2 or more care plans, the care plans are available in a drop-down. Next, you need to select the patient status type, as inpatient or outpatient. Now, let us update the patient attendant details section. Here, you will see 2 options, self and other. You will have to select self when the patient has come without an attendant, and select other when the patient has come with an attendant. On selecting other, you need to enter the attendant's full name. Next, you need to select the attendant's relationship with the patient from the drop-down. You may select Other in case you do not find the exact relationship in the drop-down. For example, if the attendant's relationship with the patient is that of a neighbor or a friend, select Other. On selecting Other, you will have to enter the attendant's relation with the patient. Now, enter the mobile number of the attendant. After entering the mobile number, click the Verify button. On successful verification, a green check mark will appear, and the attendant receives a mobile OTP. Enter the OTP received by the attendant. Then, click the Verify OTP button. Now, let us update the Authentication Consent section. This section becomes available on selecting the Proceed Without Verification checkbox on the Verify Beneficiary page. Here, you need to upload the Medical Superintendent Declaration form. Next, enter your remarks. Then, click the Validate button. On clicking the button, the application displays a message that the authentication consent of the patient has been saved successfully. If required, you can edit the details entered here by clicking the Edit button. Now, select the checkbox if the attendant's mobile number belongs to the patient or the patient's family. And, once the patient has read the consent text and agreed, select the consent checkbox to provide approval on their behalf for sharing their personal information and health data with NHA. The Register button gets enabled when both the checkboxes are selected. Now, click the Register button. On clicking the button, the patient gets registered and is now listed under the Pre-authorization to be submitted tile. In the next step, you need to initiate the pre-authorization request for the registered patient. With this, you have come to the end of this training.